We've all experienced anxiety when doing things like writing exams, going for a job interview, or when a family member is critically ill and we are not sure that they're going to make it. Welcome to Anxiety Hut. In today's video, we'll be looking at life through the lens of a person with an anxiety disorder. Anxiety is often depicted as a condition comparable to madness. The anxious character is paralyzed by even the most insignificant inconvenience and can often be seen cowering in the face of a world full of triggers. A perfect victim in a reality where everything is frightening. This depiction is obviously dramatic and not completely honest. What it gets wrong is that a severe anxiety attack is for many the climax of weeks or months worth of pent-up anxiety. What makes anxiety truly frightening is the slow build-up to the dreaded but often inevitable panic attack. You might be thinking, what's the big deal about anxiety anyway? After all, we all get anxious every now and then. In a way, this is correct. It is in fact completely normal to experience anxiety from time to time. In life, this is almost a given. However, when anxiety becomes your dominant state of being and you experience persistent fear and worry, the negative effects of this will leak into other areas of your life and gradually become an exhausting burden. So what does it feel like to experience anxiety? How does it appear, and why is it so burdensome for those who have it? To start with, people who have anxiety have to deal with it daily and in many areas of their lives, both big and small. Imagine being acutely aware of all the ways your life could potentially go wrong and having to fight through a storm of these little anxiety spirals to get your daily tasks done. It is a lonely battle that forces you to peer at the world through a tight and suffocating lens. Anxiety takes a lot of time from day-to-day living. It makes the process of making decisions long and tedious. People who have anxiety constantly scrutinize every word and action. Too much thought is placed into each decision. For many people, anxiety is experienced at a low level. It can make sense, fizzling in the background at a sound just above silence, loud enough to notice and be unable to ignore it. Sometimes it rises dramatically or falls so that it appears to not be there, but it is always present. This has a terrible effect on energy levels. People with anxiety often feel like their energy levels are always low, and this causes them to look for the least complex options, even if it is not in their favor. There's also a general fear of risk-taking. This can cause a lot of repression and the development of bitterness and resentful thoughts. Living with anxiety means constantly being tense and expectant, stuck in a perpetual state of suspense. Multiple times during the day, a person that suffers from an anxiety disorder will find that they have stiffened, as though bracing for an attack. This feeling of tension often manifests physically, so that the muscles are tight and rigid, making them ache terribly. This feeling persists and they can go days without much relief. Instead, what was initially painful and heavy becomes a dull throb. The discomfort fades into the background, and after a while, it can hardly be detected. One can only observe the debilitating effects it has on their person, the slow but continuous wear and tear. This exhaustion is immune to even the deepest of rests and soundest of sleeps. Daily life is weighed down by mental fog. The constant mental fog can sap the life out of all our activities and social interactions. People with anxiety also describe a claustrophobic feeling, similar to the feeling of being locked in a tight space, making it difficult to move or breathe. Claustrophobia is often described as the fear of tight and closed places. In the case of anxiety, the person does not have to be physically trapped in a tight, closed space to feel frightened. The environment itself is suffocating and crushing. This can trigger physical effects such as shortness of breath and chest pain, leaving the person confused and disoriented. This only increases the anxiety, which is not surprising, since most people would be extremely anxious if they suddenly had to struggle to breathe. Sometimes, the constant worrying and criticism becomes background noise, creating a general feeling of numbness and a blank state of mind. This is because anxiety causes a hormonal rush that can leave you feeling tired and drained. For a lot of people, the anxiety eventually becomes a panic attack. Panic attacks are sharp, painful, and overwhelming, which is why they are often mistaken for heart attacks. The anxiety is hyper-real and highly concentrated. Emotions swell up and threaten to burst out, and they are made worse by the real physical pains. The pounding of the heart, sudden sharp chills, hot flushes, painful ringing in the ear, selective mutism, paralysis. It is a terrible experience through and through. Even if you know all your triggers, panic attacks can still appear randomly. In those moments, It is as though our brains have completely erased all useful information that could help us in escaping that situation. This can cause a person with anxiety to develop growing doubts about their competence, which go on to damage their self-esteem. The intensity of the fear can make the heart race and pulses pound, making the person feel like there is some disaster looming. The most basic social encounters are laden with anxiety and worry, and people and every little action feels like a huge decision. This rush of emotions would make sense in the face of an obvious threat, but when there is no obvious threat, it becomes even more frightening and harder to find relief. One problem with anxiety is that whenever a person has an episode, it can take them a long time to recover. What makes this worse is that there's no way to accurately predict the duration of a person's recovery. The aftermath of an anxiety attack can take years to recover from. Every recovery is different, and the effectiveness and duration of a recovery depends largely on the treatment method and the professional in charge of administering the treatment. The uniqueness of each case, treatment, and recovery process can make it impossible to make any accurate predictions. Perhaps the worst part of having anxiety is trying to communicate how you feel to other people, especially those you care about. People who have never had an anxiety disorder can only imagine the experience, and even the most sympathetic listeners can only nod and offer soothing words of encouragement. At the end of the day, it is a lonely walk, but with the right professional help and treatment techniques, there's hope for full recovery. There are many treatment strategies that people with anxiety use to help them change their emotional and behavioral responses to their triggers. The best example of this would be cognitive behavioral therapy, which focuses on teaching people new and effective ways of thinking about and reacting to anxiety-inducing situations. If you experience anxiety as a regular part of your life, it is important to find treatment strategies that will work for you. You might find one treatment or a combination of things, like talk therapy and meditation or exposure therapy. If you're not sure where to start, it's always helpful to discuss options with a mental health professional who has the experience to guide you on your journey towards healing and recovery. With the help of your therapist, you can identify your triggers, gain a greater insight into your anxiety, and learn to manage it more effectively. You can also change your lifestyle so that your daily routine involves practices that not only cure anxiety-related symptoms, but also prevent future anxiety attacks. That brings us to the end of today's video. If you found this video helpful, you can help us by hitting the like button and subscribing to our channel. You can also help us by hitting the bell button so you'll be among the first to know when we drop a new video. Have a great day.